Senior Director of Cancer at Medanta, Dr. Rajiv Agarwal, to this amazing session of cancer awareness, especially breast cancer. May I hand over the mic to our Honorable Principal, Dr. Anshu Arora, to take over the proceedings further.
Thank you. Good evening, ladies and gentlemen. I deem it a privilege to welcome you all to this session on creating awareness about breast cancer, one of the most common cancers across the globe. On behalf of Founder President, Dr. Ashok K. Chauhan, our chairperson, Dr. Mrs. Amita Chauhan, and the entire AIS 43 community, I extend my heartfelt and warm greetings to our chief guest and speaker, Dr. Rajiv Agarwal, Senior Director, Breast Cancer Institute at Medanta, Gurgaon. Thank you, sir, for taking out your valuable time to be here with us today. I'm honored and I have my gratitude towards my honorable chairperson, Dr. Mrs. Amita Chauhan, a leader who always leads by example. Ma'am's passion illuminates all the lives she touches. Our founder president, Dr. Ashok K. Chauhan, and chairperson, Dr. Mrs. Amita Chauhan, have now become a force to reckon with all across the globe. It is often said, attitude is a little thing that makes a big difference. And I believe with the right attitude and the right knowledge, all of us can understand the basics of cancer and follow the recommended guidelines for screening. This will surely help us reduce the number of cases and increase the survival rate by allowing treatment to begin earlier. Without further ado, I would like to invite Dr. Rajiv Agarwal to address the gathering. Dr. Rajiv Agarwal is the senior most breast cancer surgeon in Gurgaon NCR region with more than 40 years of surgical experience. At Medanta, Sir treats the complete spectrum of breast diseases, both benign and cancerous. His area of interest include breast conservation, sentinel node biopsy, and oncoplastic breast surgery. Sir is very regular in attending and presenting papers in various oncology related conferences, workshops, and CME held in India and across. Over to you, sir, and it is indeed our privilege that you have spared your time for all of us. This is being live streamed and will be watched by all the 14 branches of Amity across. Thank you, sir.
So good evening. At the very outset, I must thank the chairpersons of the Amity Group, Dr. Amita Chauhan and Dr. Ashok Chauhan, the principals of the Amity School, Dr. Anshu Arora and Dr. Aarti Chopra, and of course, Mrs. Sethi and Mrs. Shweta, the event management leaders, giving me this opportunity to interact with teaching community. Breast cancer today is a very common problem. What I have done in the next 20-25 minutes, that initial 4-5 slides will be a sort of introduction to the cancer itself, and then I will switch over a overview of breast cancer. Breast cancer is a very large subject, cannot be entirely covered in 20-25 minutes, but probably some insight into the breast cancer might be able to help you all. So cancer today has become the leading cause of death. It is the second most common cause of death across the world. Kapil. So what is cancer? Cancer is a group of diseases. Cancer is not a one disease. It's a group of diseases where the normal mechanism of cell cycle regulation are dysfunctional, leading to accumulation of cells. This can either result in overproliferation or decreased removal of cells, what we call as malfunction of the apoptotic pathways. So what is apoptosis? Apoptosis is a word which is a Greek word, means falling leaves. As in every tree, the leaves are falling and the new leaves are coming, maintaining a balance. That is the main function of the apoptosis, that is to dispose of a cell without causing damage to or stress to the neighboring cells. You will be surprised that every day in our body, about 10 billion cells die every day to balance the 10 billion production by mitosis. So insufficient apoptosis, that are either a disturbance in the death of the cells or the production of the cells, may lead to cancer. Coming to the cancers, there is a lot of confusion and misconception about the nomenclatures. I would like to be very clear that all cancers are tumors, but not all tumors are cancers. Tumors can be non-cancerous, that is benign, or cancerous, that is malignant. By and large, the benign tumors, there is no life risk. They remain localized to the area of origin. They does not spread to the other parts of the body and usually curable by surgery alone. While the cancerous cells, they have a tendency to invade and destroy the nearby healthy tissues and organs. They may spread to the other parts of the body. They form tumors there, what we call as metastatic disease. It cannot be treated by surgery alone most often, and often can be risk to life if not diagnosed early. So this is just a diagrammatic representation that these cells on the right lower side, they are producing in a very haphazard manner sort of depiction of malignancy. Coming to my main topic, that is breast cancer. It is the commonest cancer of women all over the world. It is second commonest cancer in women in India. In certain metropolitans like Delhi, Mumbai, Bhopal, Bangalore, it has taken over the cancer cervix, has become the most common female cancer. And there is a rising incidence in India. Unfortunately, since we have a lot of younger population, we are seeing a lot of younger cancers also. So what's the natural history of breast cancer? It is highly variable. It is a relatively slow growth. It is rarely very fast growing. What I mean that from the start of the cancer in the body till anybody can diagnose, it takes usually 2 to 3 years. Is generally present several years by the time of the diagnosis. And this long preclinical period, that is help us in early detection by screening methods. So today the breast cancer is affecting almost 5 per 100 females in India, while abroad it is almost 7 or 8 per 100 females in the Western world. So what are the risk factors for breast cancer? There are certain risk factors which you and I can't change, like it is almost 99% breast cancer comes in the female. Age, as the age increases, many diseases occurs, including the breast cancer. There's a prior history of breast cancer. If somebody has a breast cancer on one side, she or he is definitely on the higher risk of the developing breast cancer on the opposite side. There's a family history of breast cancer. If somebody in the first degree or second degree relatives have developed breast cancer, there may be a higher risk. Another very important thing, that breast being a female organ is affected by the female hormonal environment of the body. So early onset of periods, that is menarche, and late menopause. What I mean, if somebody has started periods at the age of 12 years and menopause at the age of 50 years, she has a higher risk of breast cancer than somebody who started periods around 16 years and went into menopause at 45. Another very important factor is first pregnancy after the age of 30 years. First full-time pregnancy after the age of 30 years is definitely a high risk factor. The previous chest wall irradiation, nowadays it is not very common, but yes, previously because of certain diseases like lymphomas, etc., there used to be a chest wall irradiation which causes higher risk. And of course, certain selected prior benign or pre-malignant conditions of the breast can pose a higher risk. But certain risk factors that can be controlled, that they are obesity, a good healthy life, that's exercise, breastfeeding, moderate amount of alcohol, no hormone replacement therapy, and definitely having children. Not having children again is a higher risk. So another risk factors, as I said, is the nulliparity. If somebody doesn't have children, first pregnancy after the 30, and other factors. Another very important thing is that we always talk of early diagnosis, and early diagnosis. Why early diagnosis is important? I think this is the most important slide of my whole presentation, and I will take a minute to explain. The tumor starts from one cell in the body, and from one cell to two cells to four cells, it takes some time, which is called tumor doubling time. And in breast cancer, this tumor doubling time varies between 27 to 300 odd days. That's why I spoke that the natural history is variable. And you will be surprised that when there is a 1 centimeter tumor, which is sometimes even difficult to diagnose, maybe 5% of patients we are diagnosing it, they have already taken 30 doublings. It means patient often ask her, Dr. Sahab, ye kab se present raha hoga? So the 1 centimeter tumor may be in the body, maybe 800 days or maybe 9,000 days. And the process of spreading of the tumor, that is metastasis, may start between 20 to 30 doublings. And when the 40 doublings takes place, because of the exponential growth of the tumor, the patient is dead. What I mean that when we diagnose 1 centimeter tumor, it has already traveled 75% of its life. And that is why an early diagnosis is very, very important. And this is just to show sort of graphic presentation that in stage 1, there is an almost 97 to 98% cure rate for 10 years, while in stage 4, it is less than 5%. So for early diagnosis, what we can do, the terminology is called screening. Screening for any disease matters that when we diagnose that disease before there are any symptoms. And screening may identify very early cases of cancer that might never have become clinically apparent. So that is the disadvantage of screening also, that sometimes we are diagnosing a cancer which is not posing a danger to the patient, but still screening in breast cancer is a very important aspect. The often question is, does the screening prevent cancer? No, it does not prevent cancer. It helps cancer find early, and then it can improve the survival and cure rate from cancer. So these are the various methods of screening. Breast self-examination today is not taken a screening procedure, but it is more of a self-awareness program, a clinical examination by a physician, what we call as clinical breast examination, and of course, the mammogram, which is the hallmark and the only modality to show to decrease the mortality by breast cancer. This is a typical mammographic machine where 2 X-rays of each breast are taken as a screening procedure. And this is what a sort of mammogram looks like. This is the normal breast, but these lumps are definitely abnormal and looking like cancer. This is another mammographic photograph. So what are the signs and symptoms? How the patient presents? Patient ko kya feel hota hai when we think of cancer? Let me tell you in the very beginning that there are no 100% specific symptoms or signs. Even sometimes the infections, the non-cancerous tumors may present in the same way, like there may be a lump or mass in the axilla, there may be a lump in the breast, there may be thickening of the skin, there may be blood-stained nipple discharge, or the nipple has gone in, or there may be edema or erythema of the skin. Like there is a lump, if you can see, there is a lump here. The nipple is gone in on your right side. There is a dimpling of the skin on the lower side. The skin has gone in. There is a blood stained discharge. Again, the nipple has gone in, or there may be swelling of the breast. This is a sign of fairly advanced cancer or a particular type of cancer, what we call as inflammatory breast cancer. So whenever, how do we diagnose breast cancer? It is always by what we call as triple assessment, that is examination by a doctor, some investigations like mammogram, ultrasound, or MRI, and of course, the most important thing is tissue diagnosis, or what in common terms we call as biopsy. Why we need a tissue diagnosis? Because mammogram or clinically there is no 100% way of differentiating between benign and malignant tumor. Not only we diagnose tumor, we today breast cancer is not a one disease. There are various types of breast cancer. So by doing the biopsy and study, we characterize the malignant masses, and of course we do certain tumor markers to characterize this. And once we know the disease status, it helps us in treatment discussion with the patient. So what we do for tissue diagnosis? In India, unfortunately, commonly we are doing a FNAC, what we call as fine needle aspiration cytology. But ideally, that is not a gold standard, because there is a 10% failure rate and it does not characterize the cancer. So today, the gold standard is core needle biopsy or two cut needle biopsy, or a vacuum assisted breast biopsy, which is again a type of needle biopsy, which gives us not only the diagnosis of cancer, the type of breast cancer also. Surgical biopsy today is very rare. Maybe we are doing maybe once in a year or so. And what are the various types of breast cancer? Because patient often asks us, Dr. Sahab, kya ye phailne wala cancer hai? So broadly, I will only define that there may be two types of cancer. One is what we call as DCIS, which has the least tendency to spread, and the other is what we call as the invasive carcinoma, which has a tendency to spread. Once we have diagnosed, the next question patient asks us, Dr. Sahab, मेरे कैंसर की स्टेज क्या है? How stage helps? Because it helps us in making a decision planning. Stage 1, 2, and 3, when there is a very localized breast cancer only to the breast, we call it stage 1. If there is a cancer in the breast and maybe some cancer in the nearby axilla, we call it stage 2. If the cancer is locally advanced, but it has not spread to the rest of the body, we call it stage 3. And of course, if the cancer has spread to the lung, liver, or bone, or other organs of the body, we call it stage 4 cancer. So why we again want to have an early diagnosis? Because today the breast cancer treatment has changed from total removal to majority of the cases we can save the breast if diagnosed early. So that is why if the tumor is small, diagnosed by screening, almost in 70% patients, we can do a breast saving surgery without compromising cure. While if the tumor is big, we have to lead to the mastectomy. So what is breast conservation surgery? It is very appropriate for early breast cancer. The cure rate is equivalent to removal of the breast, but important is small tumor size and ratio to tumor and breast size ratio. And this is how we do. This is a small tumor. We just move the lump with the surrounding normal margins. And this is the result. This case I did about 20 years back. You can see a fairly acceptable cosmetic result. Over a period of 20 years, we have developed even better techniques where the better results can be given to the patient. This is a front view of the same patient, January 2002. Another view of the same patient. So there are certain newer concepts. I will be talking main of the primary reconstruction, that when we remove the whole breast, of course, this is always a psychological trauma to the patient, because breast is a sign of femininity. One can do a reconstruction of the breast at the same sitting while removing the breast. There are various ways of reconstruction where we can save the skin and do either a silicone implant reconstruction, like this is a patient we are doing a skin saving mastectomy. This is a silicone implant put under the skin and it gives a good shape to the breast like this. Another way is when we remove the whole breast, we can take the tissue from the abdominal wall and we can do a breast reconstruction. This is a patient, she's around 48, 50 years. We removed both the breast, but saving the skin, saving the nipple. We did a reconstruction from the abdominal wall and you see the result. Of course, not in every patient, the result is so beautiful, but this patient, unless you see the scar, this is as good as the normal breast. Just in the last few slides, I'll be talking about a lot of myths and misconceptions about the breast cancer. Often patient thinks that the mammograms are painful. No, it is not painful. It causes some discomfort because during mammogram, they compress the breast, but with a trained technician, I think mammogram may be a little uncomfortable, but not painful. Another important thing is there's a lot of concern that mammogram causes a lot of radiation. Let me tell you, today the indication of screening mammogram is every year from 40 years of age up to the 70 years of age. But the total cumulative dose of mammogram over a period of 30 years may be as less as a CT scan. So there is no proven radiation risk of the mammogram. I'm too young to worry about breast cancer. That is not correct. Though the breast cancer is more common after the 40 years of age, but as I said in the very beginning, we are having a lot of young breast cancers. In my 40 years of career, I have seen breast cancer as young as 16 years of age. If I have a breast lump, it is a cancer. No, all breast lumps are not cancer. In fact, below the age of 40 years, almost 95% breast lumps are not cancer. Of course, as the age increases, there is a higher incidence of breast cancer. I do not have a family history. So how can I develop the breast cancer? So that is not correct. 90% patients who come to us for breast cancer have no family history of the breast cancer. It is the first cancer in their family. Only 10% cases have a family history or genetic type of breast cancer. Breast cancer is a disease of women. Of course, it is a disease of women, but 1% incidence of male breast cancer is also there. My mammogram was normal, so I don't have to worry about breast cancer. No. Today's mammogram is maybe normal, but if I don't repeat a mammogram for 3 years or 4 years or 5 years, we are missing the thing. So mammogram should be done after the age of 40 years every year. And of course, this is the biggest myth. I answer this question virtually every day in my clinic that needle biopsy can cause cancer to spread. Let me reassure you again and again that needle biopsy, there is no scientific proof that needle biopsy causes cancer. It helps in correct diagnosis. We do at least 200 biopsies every month. So there is absolutely myth and misconception that needle biopsy causes cancer to spread. And of course, till 1982, we were removing the breast of everybody. Since the 1982, the papers started appearing in literature. And today we have the backup of 40 years of literature that in selected cases, breast saving surgery, what we call as breast conservation surgery, is as safe as a mastectomy or total breast removal as far as the cure rate is concerned. So just the last 2 slides. The Sidney Farber in 1962, which holds even today, the greatest need we have today in human cancer problem, except for a universal cure, is a method of detecting the presence of cancer before any clinical signs and symptoms. Though this statement was made in 1962, it holds even today. Next, the moment somebody diagnoses cancer, they think it's a death sentence. I would like to reiterate that we knew innovative treatments helping battle against cancer like never before. It's time to stop treating cancer like a sentence. It is time to say we can heal. Thank you very much.
Thank you, Dr. Agarwal. We would now like to take in some questions which the faculty has to ask. I may first request Ms. Dipali to ask her question. Ms. Dipali, please ask your question. Can we have Ms. Dipali asking the question, please? If Dipali is not there, can I request Madhu Gulia to please ask the question to Dr. Agarwal?
Thank you, Sangeeta. Good afternoon, doctor. One thing I would want to, ask is what prevents people for going in for the initial screening is the cost that is involved in mammography. Can you suggest any centers that are subsidized, are giving
Sure.
subsidized,
Yes, Mrs. Geeta.
and what is the
You see, the
approximate
biggest fear is
cost also of
Yeah.
mammography?
the biggest fear in the mind of people is nikal aaya to kya hoga?
ये भी है.
More than the cost is the fear of diagnosis.
Yeah.
Like people don't go for a cardiac test also. Nikal aaya to kya hoga? Of course, the cost is one of the cheapest investigation. Of course, not as cheap as pap smear. The cost is around in a private hospital. The cost is around 2,500. So Indian Cancer Society is probably giving some subsidized mammograms, and of course, the government hospital are giving it almost free of cost. But for a middle class and onwards, cost is not that much. It costs about 2,500 rupees in a year.
I agree with you, sir. 2,500 is very minuscule amount. If it can really save your life.
For poor people, yes, everything costs.
Yes. Thank you, sir.
And in October month, majority of the private hospitals is a breast cancer awareness month, where the majority of us are doing it at a very subsidized cost. Like this year, we did it on 990 rupees.
Yes, we did see the ads in the newspaper also.
Thank you, Madhu ma'am. I would like Dipali ma'am to please ask the question.
Thank you, Sangeeta ma'am. Good evening, sir. So my question is this, that if we have, family members from both sides of the family who have had cancer, is there by any chance, is there something that we can do to eliminate our chances of getting cancer?
No, you see, as on today, what we call as primary prevention of breast cancer, there is no vaccine for breast cancer. The only thing is that if your close first family members have developed breast cancer in the past, we can do a genetic study, what we call as BRCA1 and BRCA2. Ideally, first the family member should be tested who has suffered breast cancer. If she is negative, then the normal siblings do not need to get tested. If they are positive for normal genes, then the siblings should always also be tested for BRCA genes. Now, there are two ways of reducing the incidence of breast cancer. One is what we call as chemoprevention. There is a drug called tamoxifen, which is also used for cancer treatment. But that drug can be given for 5 years, but it reduces the risk of breast cancer only by about 40 to 45%. The other is if both genes are abnormal, like there are two genes, what we call as BRCA1 and BRCA2. If both genes are abnormal, it means somebody has almost 75 to 80% lifetime risk of developing breast cancer. Then one can take some drastic measures, which is removal of the bilateral breast as a prophylactic measure, what we call as risk reducing surgery, along with the ovaries. This reduces the risk of breast cancer by almost 90%. It also does not reduce the risk of breast cancer by 100%.
Thank you, sir. May I now ask Shalini Ramol to ask a question? Shalini Ramol, please.
Good evening, sir. Thank you, ma'am. Sir, my question to you is hormonal imbalances during menopause at times makes it necessary to take hormones which might trigger breast cancer. What is the way out in such a situation?
Hello.
Yes, sir. Should I repeat my
Hello.
question?
No, one thing is very clear, what I understand, your voice was not very clear, but what I could understand that during near the perimenopausal period, if you have some hormonal imbalances, should one take hormone replacement therapy?
Yes, sir.
The answer is no. Hormone replacement therapy, maybe for a short period like 1 month, 2 months, 3 months is okay, but prolonged hormonal replacement therapy is totally contraindicated. There was a study early this century where the study was disconnected. It was stopped in the middle of the study because the incidence of breast cancer went very high. So no long duration hormone replacement therapy, only for a short duration, maybe a couple of months.
Thank you, sir. Sir,
Thank you,
another-
Shalini. I would now request Ayushi Akshita to please ask her question. She's a student, sir.
Thank you so much, Sangeeta ma'am. Very good evening, sir. Firstly, thank you so much for giving us your precious time. So here I present my question to you. Early detection is the key, yet it goes undetected to an advanced stage. Especially in India, sir, we do not have enough knowledge about breast cancer, its symptoms and its risks. So what do you think is the missing link?
Pardon, madam?
So I repeat.
What is your final sentence?
So the thing, my final statement is we do not have enough knowledge about breast cancer. So it is difficult to detect how are we going through and do we really have cancer. So what do you think is missing here?
See, the most important thing, beta, is awareness. Awareness is the key. In India, where we have a poor population, one of my senior colleagues, Dr. Indranil Mitra from Bombay, they did clinical breast examination on about 10,000 patients. So we can train nurses, we can train paraclinical staff. They can do clinical examination of a large population for patients, for those population who cannot afford mammography, or for that matter, mammographic facility is not available in the suburban area, do not have a mammogram. So we can train our paramedical staff and make it a rule that every patient above the age of 35, 40 years who come to the hospital, their breast should be examined by a paramedical staff who has been trained how to examine a breast. At least that way, we can create a cost-effective model for creating a sort of limited clinical screening model.
Okay, thank you so much, sir. Thank you so much.
Thank you, Dr. Agarwal. On behalf of the Amity management and the entire Amity faculty, I am privileged as your patient to thank you for giving us this precious time of yours to create this awareness amongst all of us as to how an early detection and how we can prevent ourselves from going through the entire trauma of having cancer. We are blessed to have you on the platform, sir. We are honored and thankful to our dear chairperson, ma'am, who has given us this opportunity to have you amongst us today. I again, with folded hands, on behalf of the entire team of Amity, thank you for sparing your valuable time to be with us over here today. Thank you once again, sir.
Thank you, Dr. Agarwal. Indeed, it was a very knowledgeable session. And with your coming on this platform and this awareness being created, I'm sure things will change for the country and for the world at large. Thank you, Dr. Agarwal. Indeed, our honor and pleasure to host you today.
Thank you. Thank you.
Thank you, sir.
Thank you, sir. Puneet, we can end the session now, ma'am, with your permission. Can I end the session?
Let's end the session.
Puneet, we can end the session now and we can create the URL link and please share that.
Which we will share.